but in the female, it's different. And you know talagang in the acrosome, in the head, especially in the acrosome, the male sperm has plenty of proteolytic enzymes and the hyaluronidase. The proteolytic enzymes are very potent, and so it can easily penetrate the ovum. But if your nutrition is not really that good, palagi lang kayong umiinom ng alcoholic drinks, alcoholic beverages, it can affect the motility of the sperm. Yes, and if you are planning to have a child, this will affect. So if you are planning to get pregnant, tell your husband not to drink too much or abstain, if as much as possible, abstain from alcoholic drinks, because it will affect the motility of the sperm. You know, motility, you know, it's only 1 to 4 millimeters per minute. Akala mo, very powerful, pero it's only 1 to 4 millimeters. And it's not instant. The sperm has to stay 24 hours in the epididymis before it can move. Okay? And then when it is already in the testicular ducts, it is advantageous if it is kept there in the testicular ducts for many weeks, because it is really potent. But once it is in the vaginal canal, it will only take 1 to 2 days for it to be viable. Okay, so sperm in the vaginal canal for 2 days, there is a tendency for the female to get pregnant. But if it is more than 2 days, the viability is lessened. Okay, so if there is no contact for many weeks, even for many days, then you are planning to get pregnant, then you keep the sperm in the ducts for many days for it to be really viable. And then contact takes place after, for example, 5 days. So you notice that OFWs, when they arrive, their tendency is they get their wives pregnant when they arrive. And when you get to the history, usually the pregnancy takes place when the husband just arrived. Okay, because of the viability of the sperm. Nakatago na yan, nakadeposit sa testicular ducts ready. Okay? But if the female is not ready, then no fertilization can take place. We'll take that up later. And so, ganyan. So the mumps, you have to be careful with mumps. And you have to, you have to be careful. If you get married, be sure that your husband doesn't have cryptorchidism. That can be checked, because I have a cousin who has cryptorchidism, but he is able to impregnate his wife. They have one child only, but his other scrotum, when you will feel it, it's only one testis. He said, and then when he had it checked, the testis was on the, I think on the right, near already in the lower part of the abdomen, near the inguinal area. So that is why probably he is still able to get his wife pregnant. But after that, since he is already of age, excuse me. Hello, Rose. Na ako class. Huh? Yes. Kana unsa man? Sige. Sige. Buwan na ko picture ko. So that's it. If you really plan to have a family, be sure that your future husband or your boyfriend doesn't have cryptorchidism. Okay? And be sure that no history of mumps. How do you do that? You soak yourself with vitamin C so that the virus cannot get into your body. Just like now, the COVID, with a COVID case, 1,000 milligrams per day of vitamin C is not enough to protect you. You have at least 2,500. May I take 1,000 milligram tablet of vitamin C after every meal. So 1,000 and after breakfast, 1,000 milligrams after lunch, and 1,000 milligrams after supper. And I think that is enough to protect me because it is regulating. my bowel movement too. You know, it's very regular. Your bowel movement, it will be regulated by your vitamin C. You will know if you have too much of the vitamin C because you will have loose bowel movement. Okay, once you have loose bowel movement, that would be enough, or you can withdraw 1 tablet. But with COVID nowadays, talagang yun. Because, you know, there is no overdose because vitamin C is very water soluble. It's water soluble. Just see to it that you drink 12 glasses in a day from 6 a.m. to 6 p.m. Although not necessarily you have to drink plenty in the evening because you keep on going visiting the bathroom. Plus, okay, we'll talk about melatonin later. Ito, the temperature of the testes has to be maintained 35 degrees centigrade. Okay, so the scrotum has to adjust to be near or farther away from the abdomen. You know, my signal now is not good. Please make notice if I am choppy, okay? Because it is cloudy. And be sure you have a normal count of 200 million, 40 to 100 million. Because, for example, you have the minimum normal, okay, 40 million. But if it is very motile, your sperm is very active, then there is still good chances of it being able to penetrate an ovum. But even if your count is 200 million and then they are weak, the motility is not so good, then there could be lesser chances of it impregnating an ovum, penetrating, okay? So you still have to consider this, the count. And the alcoholic drinks, they can also decrease the count of the sperm. So as much as possible, if you're planning to have a family, keep yourself healthy by not indulging too much on vices. Because, you know, alcohol, you won't realize that you're already addicted to it. And our body manufactures alcohol according to need. So actually, we don't really have to drink alcoholic drinks because our body manufactures alcohol according to need. But because of business, commerce, and they have plenty of, you know, materials for alcoholic drinks. Where do you get your alcoholic drinks? Grapes, fruits, okay? Fermenting them. Even the sugar cane. They are not, basta the alcoholic drinks, you have to be careful with that. The male sexual act. You will learn that What I am discussing to you are the principles and the science behind the male sexual act. Okay, the practice, you can do it later. Be sure it is legal, okay? Because the tendency is the sexual act is only 7 minutes. 7 minutes of, if it is not legal, 7 minutes of pleasure, but a lifetime of regret. Okay? So you have to be careful with that, especially teenagers. Their emotions are so intense. And if you get carried away, you don't have the discipline. You get carried away with your emotions. Then, talaga, that will happen. 7 minutes of pleasure, a lifetime of regret. But if it is legal, 7 minutes of pleasure, a lifetime of happiness. Why? Because you have a child. But if it is not it is not legal, it is difficult to bring up a child. It's not easy. But Filipinos, we're lucky because our parents are supportive. We have a clannish. Oh, so we'll go to the hormones, okay? Now you notice that here, the teenage, pubertal age, the testosterone will spurt, okay? Will just suddenly increase in level again. And so with increased level in testosterone, the male is developed into an adult. And the teenager, na maninibago ba? Maninibago sila. And so they are excited, and usually they are so emotional, they get carried away by their emotions, and they have a tendency for their girlfriends to get pregnant. This age, teen. But when the individual reaches around 20, early 20s, the intensity is still there, but the emotions can be controlled already. They have learned. Okay. Now, so at the age of 80, the male can still impregnate an ovum, but it has to be an ovum of a young female. Of course, because if you, for example, a man would like to get married again, and it is the female is around 40. So lugi na siya. He cannot have another set of children. Okay? Because the female by that time is about to go into menopause. But the male, mayroon pa. Okay? But you have to be careful because at old age, the male also undergoes climacteric. And so this is the time when the male is para bang teenager, magselos, very, very jealous with the wife or without any reason. That is the climacteric. And then, you know, just like the female when undergoing menopause, irritable, moody, parang ganon. So you have to be careful with this. You have to understand your husband by this time. Okay. Oh. My internet is not good. We mentioned that all androgens are steroid compounds. So, since they are steroid, they use a vehicle in its transport to the target cells, okay? And so you have your sex hormone binding globulin. It is a beta globulin. Then it will go circulate for 30 minutes to several hours and go to its target organ. After that, it is either deposited, it binds to the receptor on the target cells, or degraded. The excess will be degraded, of course. And those that are bound to the receptor and the target cells are converted to the active form of dihydrotestosterone, especially in the prostate and external genitalia. Because, you know, the testosterone is important in the development of the external genitalia. So where will it be deactivated? In the liver, because the liver is the filter of the body. It is where the toxins are being deposited for excretion, supposed to be to the outside, but sometimes the toxins will stay in the liver for long, and so they hurt the cells of the liver, and they are supposed to be excreted outside. Just like your chemo drugs, it's not all of the chemo drugs that will help in the healing process of the patient. So some are deposited in the liver, and these chemo drugs are very difficult to, they don't just go out of the body like that very fast. You really have to detoxify the liver for it to be taken away, okay, for it to be eliminated through the feces or through the urine. You really have to detoxify the liver. Time and again, you have to detoxify the liver for the heavy metals and toxins, okay, because that will make the individual sick. That's just, sometimes you'll wonder why this individual, for example, cancer patient, after 5 years, nag-recur yung cancer. Why? Because the cancer chemo drugs, it stayed in the liver. And these are the ones that are hurting the patient again. So you have to detoxify the liver after the patient has undergone chemotherapy and has been pronounced negative. Clean up. Ito na naman ako, no? Ang daming sinasabi. So, the male also has estrogens. Some are produced by sertolized cells, but most are formed from testosterone in other tissues, especially in the liver. So normal male development requires the 3 hormones: testosterone, dihydrotestosterone, and the Mullerian inhibiting factor, or Mullerian inhibiting hormone, or Mullerian inhibiting substance. Okay, because you have to inhibit the Mullerian duct for normal development of the male reproductive tract. Okay, so you have your testosterone, dihydrotestosterone. Remember, it is from cholesterol. Then the mother hormone is pregnenolone. Pregnenolone is converted to 17-hydroxypregnenolone, to dihydroepiandrosterone, to androstenedione, and to your testosterone. Androstenedione, 17-beta-hydroxysteroid dehydrogenase enzyme. Androstenedione to testosterone. 5-alpha reductase to dihydrotestosterone. Okay, that is in the target tissues already. Human chorionic gonadotropin and luteinizing hormones stimulate the Leydig cells to secrete testosterone, which stimulate Wolffian duct development. In certain tissues, for example, the prostate, 5-alpha reductase converts testosterone to dihydrotestosterone. Yeah, ito, the onset of puberty. The hypothalamus secretes episodically gonadotropic releasing hormone, okay, which stimulates the anterior pituitary to synthesize follicle stimulating hormone and luteinizing hormone. The gonadotropin releasing hormone levels low during childhood, but at puberty, suddenly rises, and LH pulses greater, particularly during sleep. That's why it is important to go to sleep, okay? So that the teenager will grow taller. Increased LH stimulates the Leydig cells to secrete testosterone. Kaya pala ang mga lalaki, di ba? You notice that the teenagers, they are fond of sleeping, waking up late, having a nap after lunch. Normal sa kanila yan. Sometimes they even sleep at around 9 o'clock or 10 o'clock in the morning. Parang power nap. Mga 30 minutes to 1 hour, that is normal to them. We call that power nap. And that is also one way to regenerate your liver. You have to give your liver a chance to regenerate because it is working hard for the body. Okay, so what do you do? How to regenerate the liver? You sleep early. Can we do that? Ako, I sleep early at 3 o'clock. Kayo, you have to sleep early, then wake up early. For example, you have to at least 3 hours for the liver to regenerate. So, for example, you wake at 3 o'clock. 3 o'clock. 1, 2, 3. Because the liver will regenerate between 12 to 3 or 1 to 3 at that time. And if you're asleep, by that time, your liver can regenerate. But if you are awake, you are not giving your liver a chance to regenerate. So see to it that along that time frame, tulog kayo. Then you can wake up early, 4 o'clock. And then the rest of the day, you can have power nap. That is one way for you to cope up with the stress in the medical school. Because the liver is very important. Naku, nagchismis na naman ako. Sige, we will proceed. During puberty, sensitivity of the gonadotropes to feedback inhibition by testosterone decreases. Okay. So you have your anabolic actions of your androgens. And you have also androgenic effects of your androgens. Development of the male accessory sex organs, secondary sex characteristics, growth of hair, like that. Proliferation of hair. But Filipinos usually not very hairy, unlike the Caucasians. And also this, I noticed this Black Africans, ang hairy nila. Because my students in Southwestern University, plenty of students from South Africa. Ang hairy nila. Parang nilagyan mo ng wig. So, androgenic effects promotes recession of hairline, baldness, if there is a genetic predisposition. But sometimes, the baldness could be due to as a side effect of maintenance drugs Like, for example, colchicine. Colchicine for arthritis, okay? Anti-inflammatory. And the side effect, if you have been using that for a long time, is baldness. There was one patient diagnosed with osteoarthritis at the age of 24. So, sabi niya, nag-maintain ako ng colchicine for so long. And then you just notice that he thought that baldness of him was natural. Yan pala, side effects of drug. Because when he stopped and he shifted to stem cell therapy, bumalik yung hair and the baldness was corrected. Ayan, ito mga teenager na ito. Libido. Palaging mag-chancing, okay, sa mga girls. Okay, dito na tayo. The disorders related to the male reproductive organs. One is benign prostatic hyperplasia, BPH, probably a normal part of the aging process in man, caused by changes in hormone balance and in cell growth. One day, the male will just notice, the adult male, trouble getting a urine stream started, and then dribbling of the urine. A sense that bladder is not completely empty after urinating, usually around 50 years old up, may cause the bladder to be blocked, making it extremely hard to urinate. The ureter is blocked because the prostate is getting bigger, may cause the bladder to be blocked, making it extremely hard to urinate. BPH does not cause prostate cancer and does not affect a man's ability to father children. And it does not cause erection problems. Sa urination siya. More for the urination. What is the cause of cancer? Bacteria, virus, parasite, toxins, heavy metals, like that, and toxins from within your body. Where do you get toxins from within your body? If you worry a lot, okay, that's why do not worry, because the problem will just solve by itself. There are so many ways to solve the problem. So if you worry, your cells, cell communication, we had that. I have a subject on cell communication when I was at the University of Hong Kong. And whatever you think, your cells can hear and will react accordingly. Okay? So if you think you're dying, your body will react accordingly. So the amount of mitochondria in your cells will start to decrease. They will also start to die. And that is where, because mitochondria is energy production, right? That is where the energy is being produced. So if you think that way, talagang pupunta ka na doon. You're really going there. But if you are always positive in your thinking, what do you mean by positive? That you can overcome problems, okay? If it's always positive, being comfortable in uncomfortable situations, that's positive, okay? If you are always positive, no matter how hard, how difficult is the situation, you can overcome the problem. Okay, just like you in medical school now. No matter how you think it's difficult, but actually it's not. Pabasa-basa lang kayo dyan. You think it's difficult? No. Because you think it is difficult. Actually, it is not. It's just that it needs patience to read with concentration, with focus. Okay? It's not difficult at all. It just needs patience and perseverance. According to my lolo, patience and perseverance will accomplish thy labor. Ganon. Okay? Medical school, that is precisely your mindset. Okay? I can pass this exam. Imagine the exam is 100 items. Imagine your score at the upper right-hand corner of the paper to be 100. Okay? Always imagine that. Pagka mag-slide-slide, 95. Mag-slide-slide pa, kasi hindi nakaaral na masyado, 90. See? But if what is in your mind is 85, pag mag-slide, 80, 75. Pasado pa rin, pero minimum. Okay? Anyway, ganon. So, what do you do with your benign prostatic hypertrophy? Surgery, usually surgery. But since I am in alternative medicine, I do not recommend surgery. What we use in alternative medicine nowadays is oral stem cell therapy. But these synthetic medicines, tamsulosin, finasteride, tirazosin, you can also use that. Their effect is very fast. So it can relieve obstruction of your BPH. Ito, impotence. Impotence, erectile dysfunction. Inability to achieve or maintain an erection of sufficient rigidity for sexual intercourse. For erection to take place, nitric oxide is needed, for it simulates guanylyl cyclase that catalyzes cyclic GMP formation, just like your cyclic AMP, remember? But this one is guanylyl cyclase, catalyzes cyclic GMP. It converts GMP to cyclic GMP, just like cyclic AMP, okay, adenyl. Okay. So the drugs that prevent the enzymatic termination of cyclic GMP can therefore prolong erection. And one example is your Viagra. Viagra pala is very expensive. I was thinking it is just 150 pesos. Hindi pala, parang 700 daw yan noon. Aywan ko ngayon. People are using Viagra or Cialis. That is tadalafil. Viagra is sildenafil. Levitra is vedinafil. So they inhibit the enzyme that destroys cyclic GMP. What is that enzyme? Your phosphodiesterase. Okay. But what I am using is the oral stem cell for impotence. Kailang mahal. I think it is just more comparable with Viagra because that is only 350 per tablet, the oral stem cell, but the sildenafil, very expensive talaga ito. 900 na siguro ito, one capsule. This is very expensive. Anyway, it depends on the financial capacity of the patient. Okay. Castration, eunuchism. This happened, talaga. Itong internet ko talaga, my pointer has a tendency to anyway. Ito, when a boy loses his testes before puberty, the boy will become a eunuch. The boy continues to have infantile sex organs and other infantile sexual characteristics throughout the life of the child. The height of an adult eunuch is slightly greater than that of a normal man because the bone epiphyses are slow to unite, although the bones are quite thin and the muscles are considerably weaker than those of a normal man. Parang babae siya. The voice is childlike. There is no loss of hair on the head, and the normal adult masculine hair distribution on the face and elsewhere on the body does not occur. Para siyang girl. When a man is castrated after puberty, some of his male secondary sexual characteristics revert to those of a child, and others remain of adult masculine characteristics. The sexual organs regress slightly in size, but not to a childlike size, okay? And the voice regresses from that of the base quality only slightly. Conversely, there is loss of masculine hair production, loss of the thick masculine bones, and loss of the musculature of the virile male because of the testosterone, lacking testosterone. Also, in a castrated adult male, the sexual desires are still present and erection still occurs. Next is Adipose genital syndrome or Fruelic's syndrome or hypothalamic eunuchism. In German, if you have an umlaut, you know, two dots at the top of O, that's an umlaut, the two dots. You pronounce that Fruelic's, not fro. It's not an O. Fruelic's syndrome or hypothalamic eunuchism. There is a disorder in the hypothalamus. The hypogonadism are caused by a genetic inability of the hypothalamus to secrete normal amounts of gonadotropic releasing hormone. This often is associated with a simultaneous abnormality of the feeding center of the hypothalamus, causing the person to greatly overeat. Okay, so the person looks obese, like a female, because there is gynecomastia plus overeating. But if you look at the sexual organ, it is that of a male. Klinefelter's Klinefelter syndrome is XXY. It occurs one in 500 male births. Okay. This is due to an extra X chromosome caused by meiotic non-disjunction. Note here the relatively increased lower upper body segment ratio. There is gynecomastia, small penis, and sparse hair with a female pubic hair pattern, that of an inverted triangle. X can come from the sperm or the egg. Leads to a male child of normal appearance before puberty. At puberty, no testosterone is produced, and so hypogonadism manifests. Signs and symptoms: small, firm testicles, low testosterone, infertility, decreased libido, incomplete masculinization, female body hair distribution. So, walang mustache, okay? Female body hair distribution, sparse facial hair, armpit, and pubic hair is like an inverted triangle, okay? So what Klinefelter's? Adipose genital Fruelic's syndrome, eunuchism, benign prostatic hypertrophy. Now you notice that my slides has more than 8 lines because the SOP is, if you make a PowerPoint slide, it has to be only 8 lines. If it is more than 8 lines, then you have to apply animation. This is what I am applying. Okay, so during your report, that is what I always look at, the 8-liner slides. If it is more than 8 lines, you apply animation. So that's why you notice that, for example, Klinefelter syndrome, that is 1 line already. So next line, I have to introduce through animation, okay? Slowly, so that you can go even more than 8 lines, okay? Like that. You can slowly explain using the lines. So, pwede yan. Like that. But you have to do animation. Okay? You can let the lines fly in, but in this case, I chose not the lines not to fly in, but to float slowly up. Okay? So I expect you to be applying animation, not just like, not like the movie one, but the lecture type of animation. Okay, how about the pineal gland? This is the one that produces the hormone melatonin. Pineal gland is a tiny gland found close to the hypothalamus. This forms a neuroendocrine link with the suprachiasmatic nucleus of the hypothalamus and synthesizes the hormone melatonin. Serotonin is the neurotransmitter where melatonin is derived. And serotonin also comes from tryptophan. Okay. So the amino acid derivative of melatonin is actually tryptophan. But the direct derivative is serotonin. Serotonin is a neurotransmitter. N-acetyltransferase is the rate-limiting enzyme for the synthesis of melatonin. Since N-acetyltransferase has a cyclic pattern of activity, then the secretion of melatonin also shows a circadian pattern. Synthesis is stimulated by darkness and inhibited by light. When it is already dark, your melatonin will start to be produced. And your body will react accordingly. Melatonin may transmit the information that nighttime has arrived, and thus body functions are regulated accordingly. And do you remember your cortisol? Your cortisol level is at its lowest at around 6 o'clock in the evening, okay? That's why at that time, around, for example, you are working in an office and then you're off, the tendency, you feel as if you're sleepy, okay? Because your cortisol is low, and it's lowest at around 6 o'clock in the evening. So that's why you are very sleepy at that time. But, you know, business executives, they have a way of overcoming that. So they usually take power nap at that time before dinner at 7, so that they can overcome, okay, the effect. And melatonin also will transmit the information that nighttime has arrived. So what will the body do? It will learn to relax. Yes. Anything? Melatonin has been found to play a role in induction of sleep. And its feedback to the suprachiasmatic nucleus of the hypothalamus at dawn or at dusk can help evoke day-night entrainment of the SCN cycle, 24 to 25 hours of the suprachiasmatic nucleus. I joined a research on melatonin when I was at the University of Hong Kong. The main researcher actually was a British, and we just joined her. And so she was using quail, at first quail and then chicken. And she was only using the eyes to stimulate the pineal gland to produce melatonin, the eyes of the chicken. And every time he does the trials, she uses chicken. And you can just imagine, since she was only using the head of the chicken and the head of the quail, first quail birds, you can just imagine the technicians. They are happy because they will be cooking the body of the chicken, because the research only involves the eyes, So the rest of the body is libre. And then there is no anesthesia. Nothing is applied. Only the light and the dark, Oh, so the technicians in the laboratory were very happy. Always happy. Every time there is a trial. Because we use 30 chickens. Imagine. And 10 years after the research, some other students also did a research, and they came up with these melatonin tablets. So that was already in the 1990s, 1995, 96, the melatonin tablets started to come out. Excuse me, my battery is low. And so this melatonin was used to overcome jet lag. When you travel far distances from, for example, Manila to San Francisco in the US, Manila to LA in the US, Manila to Vancouver in Canada, Manila to Amsterdam, Manila to Riyadh in Saudi Arabia. That's quite far. So usually the flight that takes around 13 hours, that will affect the biorhythm of the individual. And so that's what they call jet lag, because the biorhythm cannot yet cope up. So by the time the people in that place, for example, when I went to US, my port of entry was San Francisco. By the time they're asleep, you're awake. And by the time they're awake, you're asleep. That's jet lag, because your biorhythm has not adjusted. It will take you around 1 week to overcome that. Okay. So that is your pineal gland. Very small gland, but very important. And now they are using melatonin to overcome COVID. Why? Because you need to sleep. Why? To boost your immune system. Because sleep is an immune booster. You need to sleep at least 7 hours for your immune system to be healthy, enough level, okay, of your white blood cells, your immune, immunocells, okay? So you don't be afraid, even if you don't have immunization or vaccines, because your immune system, you are confident that your immune system is good. Plus your vitamin C. Your vitamin C cements the cells together so that toxins cannot enter the body easily. Okay. Plus vitamin D. They are using vitamin D3, 1,000 milligrams a day. So protection for COVID, vitamin C, melatonin, vitamin D3. Okay, we're done with the male hormones and the pineal gland. Okay. We will start talagang the testosterone of this guy is really very high. Okay? Tingnan nyo ang mukha. Really a male. So I will stop sharing this. Then we will go to the female reproductive. We'll just take up a part of it because